Hi, we're going to talk today about the level of the pelvis. 90% of the female population has an unlevel pelvis, and this is one of our secrets to helping women get out of pain quickly. It affects men also, but not to the same extent. But I wanted to explain to you how we use this analysis to help people get better rapidly. So the pelvis in general is comprised of two halves. So when she puts her hands on her hips, that's really putting her hands on her pelvis. And the pelvis is held together in the front by a ligament right here. And then in the back, if you can see, I'm just going to show you my pelvis, is that it's held together, it comes together in two spots here. And these pale blue plastic things here, they represent ligaments. And these ligaments are what hold the pelvis together and hold it so that it's level. So Mother Nature made us to be symmetrical and to be level, but through the process of childbirth or maybe crossing your legs too much for the course of a lifetime, one side will shift up. And then what happens is these two halves come together and they form deep joints called sacroiliac joints. And those form the dimples that we see in the back. And when this joint moves, or this one on both sides, moves 2 millimeters, it causes excruciating pain. And guess what? The sacroiliac joint is right here. It's right next to the lowest lumbar levels at L5, S1, L4, L5. So it's often very multifactorial, and it's difficult to distinguish whether this pain is from the low back or from the sacroiliac joint. So one of the first things that we do is we always assess the level of a pelvis. So right here and right here, we can see that she's pretty level, unlike most of our clients, but this side's a little bit higher. And we have a process of getting the pelvis level and a series of exercises. So the first exercise that we do is a seated piriformis stretch. So let's have you sit. And let's have you bring your right leg. Okay, first of all, her hips, knees, and ankles are going to be perfectly in alignment. And you're going to bring one leg up into a piriformis stretch. We're going to take a look. So this side's about this high. And then let's take, oh my. So this side is way higher than the other side. So we know that this side of the pelvis is stuck and it needs to get unstuck. Do you have problems with your left sacroiliac joint?
Sometimes.
Okay. So now we're going to teach her the series of the next 3 exercises to help get her pelvis into alignment. So now we're on to exercise number 2, step 2 for getting the pelvis level that you're going to be doing at home. So we're going to first flatten the back. We're going to squeeze the butt. We're going to squeeze the pelvic floor. And we're going to squeeze the ball as hard as we can. And we're going to exhale through pursed lips. We're going to blow out. It takes about 10 seconds to fully exhale. So this is going to keep you from holding your breath, which we never want to do. And it's also going to keep you from having to count. You already know that you're holding it for 10 seconds. And then you're going to relax. Later on, your therapist might ask you to actually do a lift of your butt. We'll assess the first day whether you're able to do that or not. But let's try one that way. So you're going to always flatten your back, squeeze your butt, squeeze your pelvic floor, Squeeze the ball basically as hard as you can, and then let's lift, 3 or 4 inches. Then you're gonna super squeeze the booty as tight as you can while you exhale. Hold it for 10 seconds and then slowly lower. The big thing to remember is you're gonna keep your butt squeezed on the way down. Super important. This is how we build strong glute muscles super fast. This is how you get out of pain and stay out of pain. These exercises you're gonna do for the rest of your life because they're gonna keep you out of pain. And guess what? If you do them when you're not in therapy, they're gonna work to get you out of pain. So then the next step that we're going to do is we're going to do something that I call the belt out. And we're going to always be in good alignment. If you don't have a ball, you can just bend over a pillow and put it between your knees. But the hips are about 5 inches apart. So the knees and ankles should be about 5 inches apart. Then we're going to take a belt. You can use any old belt that you have. This happens to be a gait belt. You could use the belt from your robe. And we're going to put it around the knees. And once again, you're going to flatten your back. You're going to always squeeze your butt. And you're going to push out against the belt as hard as you can while you exhale. I'm holding the belt because mine unfortunately slips. And then you're going to relax. Now we always start with 20 repetitions twice a day. Then we're expecting you to get to 30 repetitions the following week, 40 repetitions the week after that, and 50 repetitions the week after that. So you'll be doing 100 of these a day. This actually does 2 things. All of these exercises do. They not only strengthen your butt and your core, they are pulling your pelvis back into alignment, getting you out of pain. They're super important for you to get out of pain and to stay out of pain permanently. All right, then step number 3 is we're going to set you, the next step is going to be self-leveling. So self-leveling, we determined that this leg, no, the left leg was too high on her. So she's going to do a self-leveling maneuver. This side was too high, so she's going to bring this leg up. She's going to push with oppositional pressure the knee into the hand into the knee, and with the same amount of pressure, she's going to dig her heel down. She's going to do that with her maximal force. If this increases your pain, we might decrease it to 75% of force. We usually do this 10 times. It's super important that this force here matches this force there. We'll be practicing this in the clinic, and you're going to get very good at this whole process. I've had many patients tell me that this has allowed them to be able to get back to walking, going to be able to shop at a shopping mall, and be on their feet for long periods of time without being in pain. Okay, so she's going to do that 10 times. All right, then she's going to demonstrate good body mechanics in doing a log roll to get up so she did not twist her pelvis, because once we get the pelvis level, we want to keep it level. All right, now she's going to sit back. Well, actually, she can sit right here. And she's going to finish up this process with what we started with, a piriformis stretch. And we're going to hold this for 1 minute to 2 minutes on both sides. So,
preference of which side I start with?
Yeah, let's start with the right side. Okay, and when we do this one, we're going to always sit up straight on our sit bones, keep the back perfectly straight, lean forward, and breathe into this. We're going to hold it 1 minute on each side. Now what she's not doing is slumping her back. Can you show how not to do it? Yeah. Yeah. So no slumping the back. We want a nice, perfectly straight back, because Now she's feeling it back
Yes.
here. Some of you might be so tight you also feel it in here. You might feel it in your knee. And you might not be this flexible to start with. You might, yeah. We're going to go to the next side. There you go. Look at that. She's perfectly level. Do you see how both knees are at the same height? She just fixed herself. And that's what we want to teach you to do. So this process of getting a sacroiliac strong usually takes at least 2 to 4 weeks just to get the glute muscles stronger. And this also gets the core strong as well. And then you'll be able to fix yourself. So thanks for watching my video.